The studies were not all consistent, but fundamentally we carried out a meta-analysis on 17 cohort studies, which show that there is not a very high, but a high risk of breast cancer, increased breast cancer with increased level of IGF-1 in the bloodstream. We can also find that recurrences in breast cancer associated with the levels of IGF-1. This high risk is present only if the IGF-1, but also PDGF are high. PDGF has the function of activating the expression of the receptors for IGF-1. So when you have both the receptor and the IGF-1, this is a small study only on 10 patients. It's not statistically valid, but that doesn't mean that it's not interesting. One interpretation which is very interesting of the role of diet in this complex of factors is connected to calorie restriction. You know that it's 101 years. We have known for 101 years that if we feed our lab animals less, they live more and they are healthier. You see, the first study was in 1909, Peter and Rouse on chickens, and the last publication was made by Coleman in Science last year. And our studies on monkeys, these researchers randomized two groups of 38 monkeys. The right-hand ones could eat as much as they wanted, and the 38 on the left-hand side had a 25% calorie restriction. They were followed for 30 years. It's a very long time. Now it's been 100 years since proof of the fact that this is important. Maybe we could give it some thought. This study on monkeys, 8 in the control group developed cancer, 4 in the calorie restriction part, 4 had an infarction, and only 2 in the other group, 17 in the control group developed diabetes, and none in the calorie restriction group. So this proves that it's important. Let's go back to our Diana study. The main indicator we were interested in was testosterone and SHBG. The type of action that we developed here was calorie restriction. They could eat as much as they wanted, but they should eat low calorie density. So in this study, all the women lost weight. Well, in the control group, testosterone SHBG, it increased in 20 and went down in 29. These women had changed a lot, while in the group that had undergone surgery, there was a very significant increase. However, if we see how this change occurred as a function of the weight loss, the women who lost almost 6 kilos, those that lost 4 kilos had a minor change, and those who lost 2 kilos had a lower change. So in this study, before making the study, we had a certain number of assumptions. We decided to use low glycemic index foods, rich in estrogens, phytoestrogens. We used a number of those polyphenols that we spoke about earlier on. It was rich in delphinidine, which is what we spoke about this morning. But it is possible that part of the protective effect is connected to the fact that these women actually had fewer calories.
Today, it's very clear how it works. Calorie restriction acts by activating AMPK, the fuel indicator, when there's very little energy, when the ratio between AMP and ATP is high, AMPK is not activated. And there are many activation pathways. It activates CDK, etc., but above all, it activates the tuberous sclerosis factor, which via cascade of events inhibits IF. I'm not going to go into too many HIF, sorry, I'm not going to go too much into detail because we talked about them this morning. But this is the synthesis pathway for growth factors. And on the other hand, growth factors are what have the opposite effect. By ACT, etc., and P13K, they have the opposite effect. Now, of course, we could do various things. Delphinidine, for example, as we heard this morning, inhibits P13K, and other polyphenols also act in the same zone to also inhibit the MABK pathway. But it's possible that much of the effects of diet can be explained by this activation of AMPK. And in the Diana 1 study, the old trial, we're now up to Diana 5, but at the time we were not able to significantly reduce EGF-1, because to reduce EGF-1 it's not enough to reduce calories. In this trial we reduced fats, we increased carbohydrates, but only low glycemic index. We didn't change the proteins. 15–16% of total calories came from proteins. In the control group, these were primarily animal protein, and in the intervention group, mainly vegetable protein. But the total proteins were not unchanged. Luigi Fontana's studies on